Our next career opportunity is critical care nursing. The team from AdventHealth joins us with a look at careers in care nursing.
Welcome to AdventHealth South Overland Park, one of over 50 hospital campuses and hundreds of care sites, spanning 9 states in AdventHealth's connected system of care for every stage of life and health. AdventHealth focuses on whole person health and a commitment to caring for the body, mind, and spirit. Today, we're going to meet 2 of AdventHealth's nursing team members representing the intensive care unit and the neonatal intensive care unit. 2 challenging yet rewarding career paths within the healthcare industry.
Hi, my name is Dylan Dykstra. I am an ICU nurse at AdventHealth. I take care of patients in a critical care setting, so the sickest patients here, usually they're through the emergency room, people who are usually brought in by ambulance. I like them when I can help them at their worst. When a patient gets better, it makes my day. Let me walk you through an ICU room here at AdventHealth. Over here, we have our hand sanitizer, gloves, sink, everything. We have our emergency button here. And then right over here, we have our monitor here. We used to keep an eye on the patients and their vitals. Typical day can be pretty unpredictable. Some days, things are cruising by just fine. And then bang, something's in the ER. And the whole day shifted. So kind of got to stay on your toes. I like the shake up. I like not knowing what's going to happen and not knowing where it's going to end. In this corner here, we have a little dialysis hookup for patients whose kidneys are failing. We have our oxygen, suction, and medical air hookup right over here. This is one of our pumps, but in an ICU, we'll have a lot more pumps. I would say the biggest misconception is that the hands-on care is being done by doctors, but it's all really being done by the nurses' hands-on care. The doctors' roles are important, but our role is to facilitate. This is our lift. It can lift up to 600 pounds. Sometimes patients need to be moved more gently, then it helps us do our jobs more effectively. And then the bed here can help us with a number of things. They can move around, we can turn the patient, we can get a weight for us. Growth opportunities are endless, which is another reason why I really loved the field of nursing. There's options to move up in the actual hospital, like charge nursing, manager, and then there are other opportunities like educating yourself, becoming like a nurse practitioner. Advent's really good about encouraging that, and tuition reimbursement, things like that, for if I were to continue with that schooling. Up here we have our monitor, for which we use that emergency button I showed you in the beginning. If we need something emergently from a doctor, we hit the button I showed you in the beginning and it'll pop up on the screen, and then the little camera will flip and they'll be able to get an assessment on the patient. Big mindset for someone in ICU, you need to be prepared and good under stressful situations. A lot of type A personalities end up in the ICU because type A's, they like things the way they are, they know how they're supposed to be, they care that things are right. AdventHealth offers multiple options for people to sort of further look into those interests. You can, if you're in high school, we encourage high school students to kind of come in through certain programs, and we can kind of show you what a day looks like in ICU nurse. You don't even be here for a full day. We also have clinicals, which are people who are already in nursing school who follow us, and we let them do a little more, obviously, than a high school student could, and that way they can kind of see if ICU is for them.
Welcome to the NICU. My name is Joanna Smith. I am a neonatal intensive care unit here at AdventHealth. Generally, a NICU nurse is a nurse who specializes in the care of preterm infants or even full-term infants that have various needs for specialized care. It's a very interesting, emotionally charged environment. Over here is one of our rooms. We always have one room set up for an admission because a lot of times when an admission happens for a NICU baby, it's very quick. One common misconception is that we just hold babies all day. You're managing critical infants, so you're managing ventilator settings, alarm settings, blood draws, vital signs. There's things that are moving constantly, and so sometimes, honestly, more often in a rare occasion, are you getting to actually hold the infant. This right here is an incubator. We always have it pre-warmed. Like I said, it's extremely important to keep the babies warm. And then through here, these are portholes. And this is just a way that we can interact with the baby while keeping them warm. These are all the different things that we would put on the babies during an admission. And then this cute little duck here is actually a thermometer. So we place this on their abdomen, and so the incubator will actually adjust depending on how cold or warm the baby is. And then of course, we always have to have a pacifier. There's a lot of different growth opportunities as a nurse. Specifically at Advent, we have a clinical ladder here. And so becoming certified helps put you in a different level, which then opens you up to different opportunities. That doesn't always look like a management role. There's other places that you can grow. I could go back to school and get my master's in nursing, and Advent would help me do that. This is a big central part of the room. So this is kind of a snapshot of the day. It's also really helpful for the parents as an update of how the baby did overnight. In the adult world, you measure things on a bigger scale because it's a bigger human. For babies, you're measuring what seems to be tiny things. We measure in grams. But to the patient and to the family, they're actually really big milestones. And so it's a unit and a place where you celebrate the small things. And I really love that about the job. I love being able to interact with the parents while also helping them take care of their fragile child that they don't know how to take care of yet. It's extremely rewarding for that. Every day is really different. Some days are really busy, some days are really slow. That's the thing that I love about this unit is you never really know what you're walking into. I think someone that is fit for this role is someone that has a lot of emotional resilience and compassion, but also someone who knows how to have attention to detail. Those are things that if you're naturally gifted at, you would excel as a NICU nurse. I would say for anybody who's looking to be a NICU nurse, it's really important to start seeking out those opportunities. It is one of the harder fields to get into as a nurse, but it's definitely possible. If this is something that you want to do, I think it is definitely worth it. One of the best things that I've ever been able to do.
At AdventHealth, you can join a purpose-driven team focused on expanding to serve more of our community. Our network includes AdventHealth Shawnee Mission, AdventHealth South Overland Park, AdventHealth Ottawa, the newly opened AdventHealth Cancer Institute at Shawnee Mission, and opening this summer, AdventHealth Lenexa City Center. Just like you, we're driven by the aspiration to help others feel whole. At AdventHealth, our mission-based team is ready to embrace, empower, and support the whole you, body, mind, and spirit. Learn more at joinadventhealthkc.com.
I want to welcome our critical care nursing panel to answer questions about the career pathways in this exciting field. Joining us today from AdventHealth is Joanna Smith. She's an RN in the NICU, and Dylan Dykstra, RN in the ICU. Good morning.
Good morning.
Morning.
Well, thank you guys so much for being here. We're hoping to start with you first, Dylan, with a question about an experience maybe that you could share when you were able to make a significant impact on a critically ill patient.
Yeah, and I guess for me, it's more of a scenario I've been in multiple times. When people are in the ICU, very, very sick, and most of the time, thankfully, they have many loved ones who are concerned. And while there are many team members involved, doctors, therapists, our respiratory therapists, everyone coming involved, the nurse is at the bedside the whole day. So when the loved ones come by and have questions about how their loved one's doing, I've been in multiple situations where you need to explain to them what's going on, the current trajectory, and you kind of make an impact with these families. And while the patients may not even be conscious or aware of what you're doing, you are kind of rallying the family and the friends and everyone involved and just sort of impacting them and just keeping everybody calm and just explain to them what's going on exactly and what we're looking for and what we're doing and why we're here in the ICU, which is something I've done a lot, but it's an important and really nice part of the job, I think.
And what about you, Joanna? How have you made a difference on a critically ill patient's recovery?
Yeah, so in the NICU,
I mean, typically those situations are fast-paced and high-charged. As soon as that baby comes out, they're coming over to us, to the warmer if they are needing any assistance with anything. And so that entire time, we are typically doing resuscitative measures. And so a lot of what that looks like is explaining to the parents what's happening. Obviously, our patient is a baby; they cannot speak or interact with us in a lot of ways, and so we are basically explaining to the parents everything that's going on, while we're also trying to resuscitate their child.
My next question, I'll start with you again, Joanna, but how do you manage like the physical and emotional demands of working in critical care nursing, especially in the NICU?
Yeah, it's definitely a career where you have to have a really good support system around you. And so uh, have to very heavily lean on my faith, my husband, my coworkers, and my friends. And so, in those moments when those, sometimes really hard things are happening, um, you have to be strong for the patient. You're not really this sounds kind of bad, but you're not really allowed to have an emotional response in the moment, because you just need to be strong for them and take care of their child as quickly and efficiently as possible. And so, just a big part of that is, realizing that you are still a human being, though, and you do have to process what happened. Um, because if you don't, then you can't give that emotion and compassion to them. And so a lot of what that looks like is going and crying later, or going back into the nurse's station, or calling a friend. That's typically what it looks like. And then I would say the physical demands, it is a very quick paced environment. And so typically in admission, we try to do everything within an hour because we want that baby to have the most time to rest in between everything that's going on. And so we do everything in that hour, and then the rest of the time we're doing a lot of charting. And so that is kind of that time where we get to sit down, even though we're still, using our minds, and our thinking skills. We don't necessarily have to be as physically present because we do want to cluster care and make sure that baby has time to rest in between care times, is what we call it.
Thank you, Joanna. How about you, Dylan? How do you manage the physical and emotional demands?
Well, physically, good shoes and snacks ready. Sometimes you're busy, you gotta eat in 10 seconds and keep going. But good shoes also protect the feet in the back. You're on your feet all day mostly. But emotionally, kind of with Joanna, you lean on my faith. My wife, she was also a nurse, so I can talk to her about nurse jargon, and she kind of understands what's going on. And then the best thing to do, you'll hear from a lot of nurses, is you kind of vent out what happened and then you just leave it at work. You kind of just, you work 3 days a week usually, 12-hour shifts, 13 more likely. But once you leave, you're done, and you might vent something out for 10 minutes, but then you just got to kind of leave work at work to a point.
Well, that was a question I was going to ask. You have 3 12-hour shifts, you said, Dylan?
They everyone always says 12, but they're 13. You get to work about 6:30 most jobs, PM or AM depending on your shift, and you leave probably around 7:30 on a good day. But they're 13-hour shifts, but you get 4 days to kind of recoup, so it kind of works out.
So is it always the same 3 days? I guess it sounds like it is.
Not really. It depends. There are people who have really fixed schedules. They might have kids for certain times, and they'll have childcare hooked up. So a lot of jobs, if you're like, I can only work Monday, Wednesday, Friday, they go, okay.
Yeah.
Now a lot of times you have to switch a weekend, and you have to work weekends. Most people have to do their turns on the weekends, but for the most part, if you need a certain day to work, that can work out for you.
How about you, Joanna, with the hours? What is that like in the NICU?
Yeah, it's also, those 13-hour shifts, and it changes every week. We're a little bit of a smaller NICU, and so we have to really be able to be flexible. But we're also all, moms, and have a lot of other stuff going on. And so we just try to, as best as we can, be flexible with each other. But every week I work different days.
Yeah. Well, there are a lot of folks watching the call. So, just a reminder, if you got questions for Dylan or Joanna, put it in the chat. But before I turn it over to Jaren, what advice would you give someone who's looking at pursuing a career in critical care nursing? I mean, obviously they need to become a nurse, but what if they're really interested in critical care nursing? What would you advise? Let's start with Dylan this time.
I did not start. I guess I started in critical care in a step down unit, not ICU, but ask a lot of questions. Don't be afraid to ask questions. You're not going to learn things just by watching. You need things explained to you. Ask as many as you can. The more you understand, the better your patients are off. The more you understand. But don't be afraid to start lower. If it's scary to begin with, it is to start in ICU or NICU. If you need to start lower and kind of work your way up through a hospital. They're always glad to do internal transfers.
What about you, Joanna?
Yeah, I would say try to get exposure to the NICU as much as you can during nursing school or other programs. A lot of high schools nowadays will have some kind of medical science program, or even if you're out of high school, connections are kind of everything there. But even if NICU is pretty hard to get into off the bat, and so if you that's your goal, don't feel like that's where you need to start. You can start in other units like a pediatric unit or a mother baby unit, and that is always going to look better on your resume going into wanting to start into the NICU.
Okay, Jaren, it's now time to see what kind of questions we have in the chat.
Yes, we've got a very fluid chat. So, Dylan and Joanna, we will be talking to you afterwards and answering those offline and whatnot for follow up. But maybe one that we can hopefully get a few of these questions answered in this bucket is: could you maybe share a little what conditions, diagnoses are patients coming into? When people hear the ICU, they might think of gunshots and those things. Maybe there's other preconceived notions more on the NICU side. So, Joanna, if you'd want to start maybe to share what are, when you're in the NICU, what are the conditions you're treating? And then Dylan, your perspective from more of the ICU side.
Yeah, so the great thing about babies being born is we have ultrasounds, we have things that go on beforehand that we can kind of get a picture of what's going on before the baby's born. Not always, but a lot of the time. So let's say a baby comes out with some kind of congenital anomaly. Well, if we know that, then we can have the supplies and all the things that we need to prepare for whatever specific thing that baby needs. So it could be that. More often than none, a number one thing would be respiratory distress. And so babies breathe differently in utero, and when they come out, everything shifts. And sometimes babies have a hard time, or they swallow some amniotic fluid. They're not able to have that oxygen gas exchange. And so we have to be there ready to provide a way for them to breathe. Airway, if you go to nursing school, you'll learn ABC. Airway is number one. So we try to stabilize that first and foremost. But then there's various issues. So you could have a newborn that's struggling with hypoglycemia, which is low blood sugar. That's going to be something that, if not treated quickly enough, or if the patient is just in too critical of a state, they will come to the NICU and we'll have to give them IV fluids, etc. So those are kind of the majority of the cases that we would see. But at any time, a baby could do something that compromises their airway. And so we don't always get that time to prepare. We always have to have everything set up and ready to go just in the event that it could happen.
Dylan?
So that usually the ICUs I've worked at are general, so you could see anything from, and it also depends on your area. So I worked in Independence, Missouri, and that was a trauma hospital, trauma level 2. So we would see gunshot wounds. We would see anything from respiratory distress to status epilepticus, which is just nonstop seizures for some where you have to put them basically in a medically induced coma, to, I mean, we call it car versus pedestrian, but like if a car were to hit somebody, I mean, you can see all sorts of things. It really depends on where you're at. There are certain hospitals where they have different levels of ICU. So you might have a neuro ICU, so you'll see strokes, brain injuries. You'll see those things quite specifically. And then there's cardiac ICUs where you'll see heart surgeries that people get their chests open and they rearrange things. And it really depends on where you're at and what area you're at too.
And maybe the last question we'll get to, just because of time for you both, there might not be an average, but if there is an on average, how much time might you get to spend with each patient, or frame of reference on what you're providing care for them when they're in your respective departments? And also, are you involved in any surgical processes, or is it more looking like at the bedside? And Dylan, will kick that with you.
Yeah. So in a critical ICU, if you have a pretty sick patient, sometimes we call them one-to-ones. That would be your only patient, and you would probably be in their room for 12 of your 13 hours there, and the other hour would be you getting out of the room to get things for that patient while someone watches them, or bathroom breaks or lunch. Hopefully you can get one, but it depends on how sick they are. But sometimes you're in those rooms all day with those patients. You're watching them all day. They're your responsibility, so you're not really leaving to go get a lunch down the street. You are in the hospital. You're in the room with that patient. And then surgical procedures, you won't go to a lot of, like, in the OR surgical procedures probably, but there's a lot of times things crash quickly and they have to do things bedsides, like a chest tube, and planting something in the chest, or a burr hole in the head for releasing pressure, and you're going to help the doctor right there with him. You're going to be handing him whatever he needs, and you're going to be just assisting him. So you'll be pretty hands in there.
Thanks, Dylan. Joanna?
Yeah. So like I said, that admission process, we're in that room the entire time until we get that baby settled. We have line access, we have, maybe a feeding tube that we need to put down. So all of those things will happen in that first hour. We call it the golden hour. And then after that, the best thing for the baby is to rest and recover. So we have care times every 3 hours. And so every 3 hours, we get in with the baby. We try to get everything done in 30 minutes. And so after that, then the baby goes back into their crib or incubator, depending on what the baby's situation is. And we need to leave the room and give them that rest. And then as far as surgical procedures, definitely we are in there doing anything that the practitioners need assistance with. So something that's common is umbilical arterial lines, and so that's where they basically start an IV in the umbilical cord. And so the practitioner is sterile, and we're needing to hand them things, do different things. And then if the baby is stable enough, another thing that we do, which isn't necessarily an ICU thing, but as they're getting ready to go home, if it's a boy, we help with circumcisions. And so those are some other surgical procedures that we are able to assist with.